got a real treat next. Polio is one of the great challenges of our time. It was supposed to be a fast eradication effort that has turned out not to be so fast. And a number of challenges around this issue, but yet at the same time, remarkable progress. One of the people who has been leading some very important scientific work on this issue globally is, of course, right here at Stanford, Bonnie Maldonado, and she's going to talk about polio challenges and successes in reaching eradication. Bonnie.
Green is forward.
Thank you. Thank you, everybody. And my challenge will be to keep you awake after the postprandial lull starts to set in. So thank you for your, for your attention. So I was actually going to talk about my research around polio. Thank you. But you can go see our posters over in the corner. We have a number of activities. I've spent about 20 plus years. I'm a CDC trained epidemiologist, working primarily in sub-Saharan Africa and in Latin America. And a lot of my work has been in the area of vaccine preventable diseases and also prevention of mother-to-child transmission of HIV. And so what I rather would like to do today is talk about issues for the end game of polio eradication. And this comes from my background, having worked in this area for over 20 years now, and more recently having been appointed on the independent monitoring board for the Global Polio Eradication Initiative of the World Health Organization. So trying to actually make sure that the end game happens. I'm not going to talk too much about the epidemiology of why polio was chosen as a disease to eradicate. In fact, if we had picked other diseases, we probably would have already eradicated them. There's a number of reasons why polio isn't inherently a challenge, but it was chosen. So let's just start by talking a little bit about the virus. I know not all of you are virology experts. But it is an ancient disease, and looking back centuries before the Common Era, we know that it was a principal, if not the principal cause of disability before vaccines were available for polio. And in fact, one of the hallmarks of polio is that it does not cause mortality as much as it causes severe morbidity and economic impact. As you can see, these are really disabling diseases. And in fact, it wasn't until the 80s when lameness surveys were done in the developing world that it was identified that